Are you all there?
Yes.
Yes.
Okay. Do you see my screen?
Yes.
Yes.
Okay, perfect. So who's in? They kicked me out.
Are we good to start?
Who's live right now?
I am.
Yes, Karen, you can start the session.
Okay. Hi, everyone. Welcome to the session on data insights that center rural community voices. In this session, we'll hear about how gathering the perspectives of different community stakeholders can shape program and policy. We hope that you'll come out of the session with ideas for how to use the learnings from rural stakeholders gathered in these projects, and perhaps gather data in your own communities in order to target solutions that are responsive to your local needs. As a quick housekeeping reminder, I just want to let you know that on the top right of your browser, you can click on Q&A to submit questions or click on the chat box to submit any general comments you have. So my name is Karen, and I'm a Senior Manager of Research and Evaluation for No Kid Hungry, and I'm excited to introduce our speaker panel for today. First up, we'll have Dr. Carmen Biker-Shanks. She is a Principal Research Scientist at the Gretchen Swanson Center for Nutrition. We'll also have Dr. Tony Panzera. He is an Associate Director of Research at No Kid Hungry. And last but not least, we'll have Jillian Papa, an Advisor of Program Monitoring and Evaluation for Save the Children. So without further ado, I'll hand it over to Carmen to talk about how her team engaged families and program implementers to identify key strategies to address rural food security.
Great, thanks, Karen. I appreciate the kind introduction, and I'm really pleased to be a part of this session. Again, my name is Carmen Biker-Shanks, and today I'll be sharing about policy systems and environmental strategies that were generated with participants in rural areas to support family food security. Next slide. Before I get started, I'd like to acknowledge Share Strength for their commitment to learning from participants in rural places and funding the study. And I'd also like to shout out to my awesome research team for their fabulous work. In addition, all the study participants, partners, and state leads for their engagement in the project and undying commitment to meaningful results. Next slide, please. Before we dive into the project itself, I want to share a little bit of history about why we worked on this project. In 2018, Share Strength and Feeding America commissioned a study that I worked on, which looked at difficulties parents face in rural communities when trying to provide their kids food. And this was conducted in 6 states across the US. The insights provided were about struggles such as affordability and coping mechanisms, such as relying on family and friends to feed a family in a rural area. And the information we gleaned was absolutely invaluable, but it also left us all wondering what policy systems and environmental strategies we could engage in to support rural families in their struggles and their coping mechanisms. So my team at the Gretchen Swanson Center for Nutrition partnered with Share Strength to endeavor on this project. And the aims of the project are on this slide. We co-developed with family participants and practitioners recommendations for policy systems and environmental strategies to support family food security in rural communities. And then we prioritized which of those strategies would make the biggest impact in rural communities to support family food security. Next slide, please. So what are PSE strategies exactly? Some of you may be intimately aware of this and some of you may not. So I'm going to start from the basics and define what PSE strategies are. So PSE strategies are tools in communities that shape systems and structures where families live, work, and play. PSE strategies are aimed towards the community level and not the individual. Policy, so a policy, for example, is a change at the legislative level and organization levels and includes laws, ordinances, regulations, and rules. An example of this is expanding the eligibility criteria for food assistance programs such as SNAP. In the systems level, these are shifts made in the way problems are solved within organizations, institutions, or communities. An example is updating online shopping portals in a grocery chain to allow quick purchases. And then the third is the environmental level, and these are changes made in economic, social, and physical environments. A good example of this would be offering a farmer's market at a health clinic. Next slide, please. So we worked with rural residents and practitioners to accomplish this project in 3 steps. First, we conducted interviews to develop a list of PSE strategies that might work in rural communities to support family food security. Second, we sent the list generated in the interviews to participants and asked them to prioritize which strategies were most acceptable, feasible, and appropriate for rural communities. And last, we conducted a focus group to gain consensus about the priority rankings. Next slide, please. On this slide, you can see that we worked with 30 practitioners who worked with residents in rural places, 42 individuals with a family enrolled in a social service and living in a rural place. And the states we lived in were rural areas of Arizona, Georgia, Kentucky, Michigan, and Texas. And lastly, we also worked with 8 Share a Strength staff for surveys and focus groups for the national rural perspective. On the right side of the slide, the 3-step process with the number of participants are listed in each. What I want to emphasize here is that this participatory 3-step process ensured that we built consensus within and across rural participants for what PSE strategies would work best in rural areas to support food security. Next slide. So what did we find? During interviews, participants discussed the intricacies of several programs directed at food resources in rural communities that were helpful for food security. These included SNAP, WIC, school nutrition, food banks, food skills education, local food at farmers markets, and community gardens. As an example, one participant said, the backpack program is a program that provides food bags for children in the highest needs category that are identified in every school district in our county. The backpacks meet all food categories, also nutrition categories, and then also they're provided at times that they are not in school. And another participant said, we do a lot of preservation and food safety programming. Next slide, please. So during interviews, participants also discussed the intricacies of several programs beyond food resources in rural communities that were helpful in supporting family food security. These included healthcare, housing assistance, unemployment benefits, early childhood education or after school, stimulus checks, and tax credits. One participant said, I'd love to see policies that streamline the application process for all of this. I'd love to see a policy push that would streamline it, modernize the application process, and where it becomes just a one-stop shop where folks don't have a million different places to qualify for different things. Another said, my child goes to a program called After School. They have for about 3 hours from 3:30 to 6. They teach them to read. They teach them to do their homework. This program is important because once or twice a month, they meet with parents and children also, and they teach them how to brush their teeth, educate them, and teach them to read if they have reading problems. If the child has a problem in school, they help them. Next slide, please. From these very rich and informative interviews, which I showed you the very high level, we conducted with 72 rural families and practitioners across 5 states. We developed a list of potential PSE strategies. With that list, we surveyed all participants and invited them to participate in a focus group. There, they prioritized what strategies were most acceptable, feasible, and appropriate for addressing food security in rural communities. The prioritized list is on this slide. The priorities spanned policy, systems, and environmental changes in rural areas about social service program enrollment and utilization, employment opportunities, transportation and housing, participatory engagement with participants, school nutrition, healthcare, food banks, early childhood, food skills education, and local foods. All of these PSE strategies had some support and agreement for supporting food security in rural communities, but some were ranked higher than others between families, practitioners, and share strength staff. For the sake of time, next we're going to explore the top 3 and the bottom 3 ranked priorities. Next slide, please. So first up, the highest prioritized PSE strategy was to make it easier to sign up for programs to support food security in rural communities. What does easy mean exactly? Example activities that would help to carry out making it easy to sign up for programs would include making sure there are local offices in rural communities, making sure program applications are shorter, and allowing people to fill out one application that can be used for all programs. Next slide. Next up, make people more aware of services. How can awareness be generated? Through creative advertising on social media, advertising in community locations in rural areas by word of mouth, and ensuring bilingual staff members are there to tell people who need it about programs. Next slide, please. As an important note, families were less aware of social services than practitioners. On average, about 70% of families knew about social service programs listed on the bottom of the screen, while over 90% of practitioners were aware of the programs. This further demonstrates the need for number 2, which is to increase awareness of social services that can support rural family food security. Next slide, please. The third highest prioritized strategy was to make it trouble-free for people to use programs. This includes making it faster to use programs and keep benefits, change program rules about benefit use, allowing several forms of media to get services, making checkouts at the store easier for SNAP and WIC, reducing barriers for immigrant families, and following up with families when they are receiving benefits to answer any questions and make them feel welcome. Next slide. The top 3 priorities that I just talked about were about social service use. On the other end of the spectrum, there was less support for providing more places to get food locally. Participants agreed that community gardens, local food donation programs, and food prescriptions were really helpful in supporting food security. But where they agreed less was that they took many resources to start and also maintain, so they were prioritized lower in feasibility. Next slide, please. For the second lowest prioritized strategy, which was provide options for people to learn about buying and making healthy foods on a budget, these activities included things like individual classes and resources, food skills education online, cooking classes, finance classes, food preservation, and food safety classes. Much like the last slide, which was local foods, people really liked making healthy foods and on a budget and providing these in rural communities, but also found that they were resource intensive to start up and maintain, and that not everybody wanted them. Number 3, next slide. The final lowest prioritized strategy was provide options for people to learn about buying and making, actually that should say, providing expanded education hours. And so these would include providing free preschool, opening more childcare locations, opening childcare facilities and more hours, and providing bookmobiles and mobile libraries. And this one was very important for families, but again, the difficulty of expanding hours of childcare locations in rural areas was underscored as needing a lot of resources. Next slide, please. So how do we do PSC work in rural communities with this kind of information in context? A lot of the interviews, surveys, and focus groups, people's comments really focused on making sure that assets are prioritized in rural communities. So having partnerships with existing local organizations, utilizing the agricultural landscape that exists in rural communities, using existing community needs assessments to make sure that programs are built around the needs of a community, and the fact that rural communities a lot of times are very, very close-knit. For the sake of time, I won't read both quotes, but I will read one. As far as community-wise being self-sufficient, rather than having to rely upon the federal government, just being self-sufficient is good. Everybody's pitching in. It's more of a communal, like everybody helping everybody. This was a sentiment that was said over and over again about an asset in rural communities, that the close-knit nature of the community really supported food security. Next slide. And it was also really important, people relayed that there are challenges to consider: transportation, affordable health care, affordable housing, internet access, access to affordable and healthy food, limited employment, and limited childcare. In rural communities in particular, these things could be considered barriers to supporting food security, and participants underscored the need to make sure that programs fit the challenges and capitalize on the assets. So one quote that was relayed: around here, there's not a whole lot of jobs to have, and what there is, they're making a minimum wage, which is like $7.25 an hour. You can't, especially with a one-parent household, you cannot live off that amount of money as far as paying rent, paying your utilities, buying food, buying diapers, buying necessities, toilet paper, laundry soap, bath soap, and all that stuff. You can afford to do that, so you have to make cuts somewhere. This similar sentiments were provided around employment, for example, and the other challenges to consider when building programs that address rural food security in communities. Next slide, please. So here's our list of 13 prioritized strategies for rural places. You can read them here, and we'll also be releasing a report fairly soon, which you can read the details about the prioritized strategies and why they were prioritized in the ways they were. Again, there was some support for every strategy on this slide. The ones that made it to the top had more support across all the groups, and the ones that are closer to the bottom had mixed support across groups. And so one thing that I'd like to underscore here is that it's really important to, when thinking about applying PSC strategies in rural communities, it's really important to work with the local rural community to understand which one of these strategies makes sense and which will be the most appropriate, acceptable, and feasible to implement in any particular rural community. Next slide, please. So use this list to start with one thing.
I will next hand it over to Tony Panzer to talk about a survey focused on non-congregate summer meals.
Thank you, Karen. Hi, everybody. Next slide, please. So today I'm going to be giving a brief overview of survey results of a survey that we administered over the summer to rural families. And I can't believe that it is mid-October already, but the summer seems like it came and it went, but there's still a lot that we need to learn from implementation of summer meals. So before I get started, I do want to just give a shout out and thank you to the number one, to Karen Wong for being a wonderful research team member at Share Our Strength. And also I would like to say thank you to the team that made the survey possible, to Marissa Kirk-Epstein, to Carolyn Vega, and to Paige Picorni, who represent an amazing amount of knowledge about school meals programs and summer meals programs. And also to the team that took our survey and administered it at FM3 Research. So thank you to everybody who participated in getting this survey accomplished. Next slide, please. And just a bit of background, which if you've been to a few other sessions over the course of today that you've heard this information before, but just to recap, prior to summer 2023, summer meals were offered in most settings in congregate settings, that is group settings where meals were consumed on site. Last December, non-congregate meal service was made permanent for rural areas. And this summer was the first summer that permanent non-congregate summer meals settings were implemented. And later on this winter, USDA is expected to issue an interim final rule about implementation rules and guidance on non-congregate summer meals, which everybody's anxiously awaiting. Next slide, please. But just because time marches on and moves quickly doesn't mean that we can't, it just means that we need to learn fast about how implementation went, but also during the course of the summer, it's also important to listen to families. And so at Share Our Strength, our overarching goal for our research in this area this year is to systematically understand, document, and share insights about implementation of and experiences with non-congregate meals in rural areas in summer 2023. Knowing this was our goal, we implemented a survey this summer to help us understand families' experiences with summer meals for their children and preferences for how those meals are served. While at Share Our Strength, we are listening to sponsors and state agency staff, we also wanted to hear from families who would be eligible for meal service during the summer to more completely understand the experiences of all people engaging in summer meals. Our objective for this survey was to understand from rural parents' perspectives what site accessibility to a meal site means, if given the choice, what their preferences were for congregate or non-congregate service, and to understand those preferences and to understand differences in preferences and attitudes among survey respondents. Next slide, please. And so just, I wouldn't be a researcher if I didn't talk about my methods. So just a very quick summary of methods. Share Our Strength, No Kid Hungry developed the plan and purpose for the survey, as well as the survey instrument with question items, which we collaboratively workshopped within the team. We then shared the instrument with FM3 Research, who programmed the survey and piloted the survey with us to assure it functioned well. So from July to August 2023, the FM3 team completed 600 online and telephone interviews with parents in rural areas with household incomes at or below 185% of the federal poverty guideline. Individuals were included if they reported a zip code in designated rural areas, using USDA designations of rural areas according to RUCA categories 4 through 10. Interviews to complete these surveys were obtained through a mix of listed sample from voter files and commercial sources and an opt-in online panel. Quotas were set to ensure the demographic and geographic representativeness of the sample. And as a reminder, data from the survey are self-reported responses from parents about their family's experiences with and preferences for summer meal programs. Next slide, please. So first, I'm just going to talk about characteristics of the respondents to the survey. Next slide, please. So the survey respondents, there were 600 parents interviewed. Most were living in homes with 1 to 3 children and in homes with 2 to 6 family members, and most respondents were female. Most respondents come from households with combined incomes less less than $55,000 per year, with 41% earning $27,000 or less. Next slide, please. And these families also reported on their experiences of food insecurity during the summer months. In the past, so many rural families with low income faced food insecurity. Next slide. In the past year, 2 in 5 often worried about running out of food before having money to buy more. Nearly 1/3 have often run out of food, and more than 2 in 5 said their children sometimes or often did not have enough to eat. Next slide. African-American parents, when we stratified these responses by race ethnicity to look more deeply at these numbers, we saw that African-American parents were more likely to say their children were not eating enough. And I'll also say here, this is a demonstration of the importance of looking more deeply at your data. Next slide. And it's clear that summer imparts particular hardship on rural families. 82% of parents reported spending more on groceries during the summer, and families spend in our sample, spend $168 more per month on groceries during the summer after we hold household income and household size constant. And groups that were more likely to report increased summer grocery spending in our sample were parents of children ages 5 to 10 and parents that had more children rather than less. Next slide, please. And we asked families about their preferences and experiences with school meals and out of school time meals, that is, meals provided to children over the summer. Next. So while a majority have gotten school meals, 2 in 5 said their children have gotten meals during summer breaks. Interestingly, when we dove deeper into this data, we saw that larger households with adults working full-time, and those with adults who have higher education and households whose income were below $27,000 or greater than $55,000 were more likely to have gotten summer meals in the past. Next slide. And for those with prior participation in summer meals, they reported that their children have gotten them at least a few times a week, and nearly 3/4 indicated they have picked up meals to take home. Next slide, please. We asked respondents in general what their preferences were for summer meals, either picking up and taking meals home or having children eat meals on site. A majority of parents indicated a preference for taking meals home, and this preference persists across age groups, regions, and different levels of access to transportation. Next slide. Those who preferred taking meals home cite comfort and convenience as the main factors in their preference, while those preferring on-site meals cited healthy and fresh foods. To reiterate, these are self-reported preferences based on respondents' own experiences. We also saw other preferences cited. These were the ones that rose to the top for both groups. Next slide. So accessibility, appeal, and choices in summer meals were important to respondents. A majority of respondents said it is important to have both options available to them. The graph here shows the results of a question asked to respondents with prior experience picking up meals during the summer, how they would improve taking home meals when school is out. Parents most commonly said that they'd like to see availability of meals increased and more appealing options added. Next slide. Next, we unpacked respondents' views on non-congregate meals further. Next slide. And 72% said they would be likely to pick up and take home meals when school is not in session. Parents of children ages 5 to 10 were most likely to participate in take-home meals according to their responses. And those with access to a car and or a bicycle most of the time were more likely to participate in take-home meals. Next slide, please. We drilled a little bit deeper to understand what motivators would convince respondents to participate in take-home meals, whether the meals served included foods that their children liked and eat rose to the top of the list of motivators. Safety was also important to most parents. I'll also point out that offering multiple meals at a time, home delivery, children's ability to pick up meals for themselves and non-present siblings, and parents picking up meals for non-present children, and scheduled pickups are all important motivators for respondents and are actually areas that weighing in on program policy could be helpful, especially rules and regulations about how programs are implemented. Interestingly, a plurality preferred being able to pick up between 3 and 5 days worth of meals. And actually the breakdown is for 1 to 2 meals for pickup, it was about 14% of respondents. 40% of respondents said 3 to 5 meals for pickup. And then 22% of respondents indicated 5 to 7 meals for pickup. Next slide, please. We also asked respondents about their perspectives on congregate summer meals. Next slide. And 2/3 said they'd be likely to participate in on-site meals, but only 1/4 were very likely. Next slide. So based on responses from parents and caregivers in rural areas, who's likely to participate in on-site meals with respect to our sample? Families in the Northeast, Midwest, and South were more likely to participate than families in the West. African American and Latino families were more likely to participate than white families. Those with reliable access to transportation were more likely to participate in on-site meals. And we saw that the likelihood of participation did not vary by children's age or household income. 26% of those likely to participate in on-site meals said that it's because it would be, it would help financially. 25% of those unlikely to participate in on-site meals cited inconvenience as their reasoning for not participating. Next slide, please. And so just some next steps for us at Share Our Strength and No Kid Hungry. These were just a very quick overview of the survey results. We have quite a bit of results from the survey that we're continuing to digest and create reports and micro reports from. So that's where we are in the process. And we plan to continue sharing these findings as well as further insights we're learning as we continue running listening opportunities with families, sponsors, and state agency staff. Our internal team has also been part of this conversation, and that has been extremely useful for orienting this work. We have informal and formal discussions planned, and as well as more surveying. Our goal is to distill insights and compile to share. We are also interested in further understanding the experience of designating rural pocket areas, more details about when and how it's done, the decision making that goes into it, with the intention of sharing what we learn. Please feel free to check out our website, linked above, to learn more. As we develop more products and PDFs, things to share, I'll be putting them up on the Center for Best Practices website. Next slide. Thank you.
Thank you so much, Tony, for pulling this together. And I know it was a fast project that you and the team worked on at Share Our Strength. And I know this will be extremely helpful as we look towards the future for implementation, and also very informative for our work with USDA. So at this time, I'd like to hand it over to our last speaker, Jillian Papa, who will share more about learnings from a home delivery pilot in Kentucky.
Thank you so much, Karen. Hi, everyone. So today I'm going to present on a rural home delivery pilot program in Eastern Kentucky. And as a segue from the last presentation, we are currently exploring how to work with SFSP as a non-congregate feeding program. So this pilot could serve as a model for other rural communities. Next slide. Before I start, I'd like to thank all of the implementers of this project, Save the Children, Grace Hands, Midwest Food Bank, and the listed school districts here. I'd also like to thank evaluation participants and Amazon for funding this important work. Next slide. So why this project? At the time of program planning at the end of 2021, Amazon and partners looked at a few sources, including Feeding America's report of the impact on COVID on local food insecurity, as well as census data, to identify a community with high need. Harlan, located in southwestern Kentucky, was ranked in the top 4 counties projected to have the highest food insecurity rates. They also had the highest population density of the counties listed and high rates of no vehicle in the household. Community organizations in Harlan and Bell counties, in partnership with Amazon and Save the Children, proposed a home delivery pilot. Next slide. Partners set out with a project goal to reduce child food insecurity by increasing access to nutritious meals during weekends and holiday closures when school is not in session. The program aimed to address challenges listed here, so transportation, inadequate or inaccessible school meal offerings, and lack of capacity for food banks to deliver food. Next slide. The pilot program is a weekly box providing about 16 meals consisting of perishable and non-perishable foods delivered to children's homes prior to the start of the weekend. The program lasted 23 weeks from March to August of this year. During that time, we reached 1,788 children in 948 households. In terms of enrolling families, school district risk staff, that is the Family Resource and Youth Services Coordinators, led the enrollment process to identify and recruit families of highest need to gauge their interest in the program. District and school staff are one of the few local partners implementing this community-based model. The food procured for the program met USDA SFSP meal pattern requirements, and these requirements are designed to provide well-balanced and healthy meals that meet the nutritional and energy needs of children. Next slide. So what's most unique about this program is the multi-sector community model that included a variety of stakeholders leveraging their strengths and community assets. School districts recruited and liaised with families. Midwest Food Bank worked on food procurement and putting the boxes together. Price Hands stored and delivered the food. They hired people in the community to do the deliveries. Save the Children was responsible for overall project management and program evaluation, and Amazon was the funder and logistics consultant as it related to delivery. Next slide. So at the center of program implementation and evaluation was our interest in hearing community voice. We know that data collection can look different in rural communities, and we wanted to create opportunities to gather continuous feedback, both solicited and unsolicited, using a variety of methods, both formal and informal, throughout the course of the pilot. This would be from both participants and implementers. The feedback would be used for program improvement to quickly adjust in real time and or inform the next phase of the program. Next slide. So for a formal participant evaluation, we conducted 3 online surveys among adult participants. This was to provide opportunities for participants to weigh in on implementation as well as the impact of the program. One survey was 3 weeks in, serving as a check-in. We were very interested in any issues experienced initially. At midpoint, we asked a series of questions on experiences, perceptions, and preferences for the program. We also did a handful of online interviews to dig deeper into participant experiences. And at the end of the project, there was a final survey. Next slide. For the implementer evaluation, we connected with 29 implementers at the midpoint. This included discussion groups and interviews, both online and in person, as well as online surveys. We were really interested in hearing from a variety of perspectives across all of the implementers. Next slide. In addition to formal methods, informally, information was coming in by way of emails, phone calls, stakeholder internal team meetings, and even in-person walk-ins to Christ Hands. All of the information coming in typically made its way to the bi-weekly implementer sync meeting for decision-making. In rural communities, we know it's important to have these additional communication channels as methods for evaluation, and this was critical. And also not taking a one-size-fits-all approach for feedback opportunities, because sometimes usual channels for information gathering doesn't work the same way in rural communities. Next slide. Through listening, we heard from the community and were able to quickly pivot to address needs and solve problems. I've included a few examples here of how we did that. When we partnered with district leaders on enrollment, they had a lot of questions about the process early on. So we developed a number of tracking tools and enrollment forms to support family enrollment, to gather the necessary information for deliveries, including consent. We heard from delivery drivers that some properties had loose dogs and the drivers felt unsafe when delivering. We communicated to the district and Frisk staff to send messages to families that if dogs were not leashed, boxes could not be delivered. Lastly, by way of communication channels mentioned on the previous slide, we heard from participants and eventually also drivers that chicken juice was leaking through the packaging. Midwest quickly came up with a solution and changed the packaging to properly seal. These three examples speak to the success of the evaluation and communication channels in place to share information and the team's ability to quickly address issues as they heard from the community. Next slide. In addition to quick pivots, we heard a number of things that informed adjustments for phase 2 of the project. Phase 2 of this project actually began 2 weeks ago. We heard from school staff that they did not have enough time to recruit and enroll families in phase 1. We learned that the paperwork that needed to be distributed and signed was difficult to pull together in a short amount of time. So in phase 2, with new families, additional time has been provided. We also heard from delivery drivers that it was difficult to make some deliveries due to the remote nature of these rural homes and homes being unmarked. We learned this is common for rural areas, including phone numbers not working and confirming addresses to help find these houses. Routing deliveries in rural communities requires significant effort in determining whether an address is deliverable. So for phase 2, our enrollment and consent forms now ask for coordinates, including how to find coordinates, as well as a second phone number as backup. Additional time is allocated in phase 2 to leverage mapping tools, do test runs, and contact families when issues arise. The midpoint survey had 2 questions about food preferences. They listed all the foods in the box and asked participants to select their top 5 for most liked and least liked. The food that was most liked remained in the box and even was increased for certain items. But for the foods that were consistently least liked by families, they've been removed for the next phase. All of these examples speak, again, to the success of the evaluation and communication channels we set up to hear from communities and improve the program in the next phase. Next slide. We also asked a series of questions at midpoint about logistics, implementation, and preferences. This was to check some of the assumptions that we had made early on in the project and to understand if we needed to make any big implementation changes in phase 2. For example, we were concerned about the food getting into a refrigerator within 2 hours. The boxes are insulated, but summer was approaching and we were worried about safety. We assumed participants were putting food in the fridge within two hours, but wanted to ask. Upon asking, it confirmed our assumptions were right and that the large majority of participants, this was the case. 2 other examples here, one related to food waste. We wanted to check in with participants on that assumption. So we asked a series of questions about disposing of food. An additional example checking in on assumptions was that the delivery technology we were using was working. And we wanted to make sure of that. We learned that most participants received a text message when the delivery arrived. This let us know that the technology itself was working. So for example, we didn't need a new platform in phase 2, but the few that maybe weren't receiving text messages wasn't a result of the platform, but could be phone numbers. And that's where we built out those new processes in place for a backup phone number. So this slide, again, outlines some assumptions that we made early on and the conditions for successful implementation, and then the confirmation we received in our formal evaluation process. Next slide. In addition to the implementation learnings that I just shared, we also learned about how the program impacted families. Based on our survey responses, on average, participants saved $67.54 per week and 79 minutes per week in time as a result of participating in the program. Survey respondents also shared that they felt good giving their children food from the box. They believed the food was healthy, easy to prepare, and fit their family's needs. Additionally, we saw that participants felt less worried whether their food would run out before there was money to buy more. Next slide. Through our formal methods, we asked about the impact of the program on people's lives. So to add color to the implementation learnings and the outcomes that I just shared in the previous slide, We had quote after quote of the ways the program had improved participants' lives. So the constant assurance that there was always food, didn't have to worry as a result of having the box. Same thing related to transportation, didn't have to worry, cut down grocery bills, and as well as less stress and less trips to the store. Next slide. And on the implementer side, we heard from, like I mentioned earlier, a variety of audiences. So up there in the top, you'll see a quote from a delivery driver and how fulfilling it is to do this job in his community. On the left, school district staff stating that organizations have come in before and tried to do a program like this, but that this has been the best one yet. And implementers also shared the strengths of the implementer partnerships, where this idea that all of the partners come from a place of yes, and let's figure out a way to get it done. Next slide. In rural communities, it's important to offer different communication and evaluation mechanisms for gathering information when piloting a new program. So our combination of formal and informal methods, which allowed for this solicited and unsolicited feedback loops, gave us an opportunity to continuously learn and make adjustments to improve the program along the way. Next slide. Great. Thank you so much.
Thank you so much, Jillian. It's just so interesting and helpful to hear about how you leverage the data you gathered through this project to really pivot in real time and make improvements to future iterations. So appreciate you sharing about that. So we'll turn to questions in a minute, but I do want to highlight just a few common themes that I heard from these different projects. One of the themes I heard from everyone on the panel was that it's so important to identify and maximize the assets that exist in rural communities. I also heard from the panel that gathering data can be both systematic and informal, and those insights can be used both at the front end when planning new strategies and interventions, but also to make ongoing improvements to strategies and programs. And then finally, one thing I heard throughout was that just how these projects highlight how important it is to gather information from both program implementers and end users to get those different viewpoints and really round out the feedback and use that for improving programs. So just as a reminder, we do have the Q&A box on the attendee hub, and I'll first kick us off with a question for the group, and that is, when all is done, what do you suggest people do with the data that they collect?
I can take that first. I think that it's really helpful when collecting data to ask participants what they suggest as good outlets for the data. So, you know, whether that's like an infographic on social media or some sort of report to a state office that would be helpful. A lot of times when working with communities, they'll have a lot more creative ideas and impactful ideas than like I would on my own. So that's always my go-to, is to make sure that there's some sort of question that asks, like, when all this information is said and done, what do you think? Like, who do you want this information to go to, and how should that be told?
That's a great recommendation. Thank you, Carmen.
And I'll add, I think it's important to always have a line of communication with families, participants who are engaging with services, and in particular with meal services, especially during the summer. I think, you know, we did a survey and it was cross-sectional, but I think that I think it's important that we're always listening. And so having periodic surveying to sort of get a lay of the land, helps connect you with participants and understand their needs over time, because needs can change, preferences can change. So with what you do collect, it's important to act on once you get it, which is part of the reason why we're so busy right now. But at the same time, it's important to always be listening.
And I'll just add, I agree with what Carmen and Tony have said. And additionally, I think any information that you have on implementation, be surprised at how many other organizations are interested in how you implemented your program. And so documenting what we did and how we did it was a really important part of our process, so that we could possibly be a model for other organizations to consider.
Great, thank you both so much. And it looks like we have one more question. How do you set up your data collection to be flexible and inform program improvements?
I mean, I'll take this. I think there's not just one stream of data collection. And so I think part of being flexible is understanding that information could come in a variety of different ways, especially when you're implementing a program. We're human beings, and things don't always go as planned, like in a laboratory or in a controlled environment. And so I think being flexible means, entertaining different ways of listening. So we can do surveys, focus groups, and qualitative interviews. We can have informal ways of hearing immediately from program users. And I think those methods were used throughout the projects presented in this panel. So I think identifying the ways that our families in rural areas like to share their experience and making sure that we're leaning into that, I think, is important.
And I can add on to that just a little bit. I always like multi-step processes. They sometimes can take a little bit longer, but then they afford sort of pivot points in the work. And the study that I presented on was a 3-step process, and it took a little bit over a year to collect all the data, but we slightly pivoted several times just to answer questions, like get our aims of the study answered in a different way or in a more thorough way, or like dive deeper on some of the things that we were finding. So I think that's a really practical way, is like, if you're going to collect a survey, then plan to do like follow-up key informant interviews or something a couple months later.
Yeah, and I agree. I think this idea of doing some information gathering, pausing, reflecting, looking at that information, maybe you're doing interviews, maybe you're doing a survey. I think to Tony's point, we're all human, like you said, and things can come up, and maybe you need to shift your methodology or change your method, your method of data collection based on responses that you've seen or just the context that you're in.
Thank you so much. It looks like we have one last question. When working with school districts and schools, especially in communities that have high needs, how do you prioritize participation to pilot these programs? Hope I got that question right.
Can you say it again? I'm sorry.
Yeah, when working with school districts and schools, especially in communities with high needs, how do you prioritize participants to pilot these programs? Sorry about that. How do you prioritize participants to pilot these programs?
So I think the question is around like when there are high needs and there are a lot of participants that could potentially be engaged in a project, how do you like choose between a lot of different potential participants? That's how I'm interpreting it. So that's how I'll answer it. I've done quite a few projects like that where there's some sort of direct benefit being given. And so it's like, it does become like really hard to decide when there are a lot of needs that you're faced with choosing between. So in those cases, I've always worked with an advisory board in a community to help to prioritize who is participating first, second, third, etc. So that it takes, you know, as an outsider, which I typically have been, it's not really appropriate for me to choose the priorities. So I would say as much as possible, getting an advisory board to come to consensus on something is a really like meaningful strategy.
Yeah, I think that's a really good suggestion. In our case, for this particular pilot, we worked very closely with school and district staff, and particularly the Frisk staff, like I mentioned, which is the Family Resource Center. So they work with these families day in and day out. They know these families. And so we really weren't involved much in that recruitment and enrollment. We leveraged those partnerships within the schools and the districts to help identify those families.
And I'll add to that question that data collection does not automatically result in findings. There's data analysis, and I think if we also reflect on the analysis that we're performing, and I said this during my presentation, but sort of diving deeper and querying the data that we have to really understand, if there's anything that's disparate or disproportionate on different people. And then also sharing those findings, making a concerted effort to sharing those findings with the communities that we're in to help make sense of what we're seeing. I think that that's also an important aspect in making sure that what we're doing is participatory and community driven.
Thank you so much to all of you. Those are really great ideas and insights. I just want to say a final thank you to the panel and also for the audience for being with us during the session. We hope that this was informative, inspiring, and encouraging, and we look forward to hearing from any of you if you have any future questions down the line. And with that, we'll close. Thank you so much again for joining.
Thank you.
Thank you.
Thanks, everyone.